Thank you, Ashwin. It's a pleasure to be here today. Thank you for having me speak today at TEDxRiceU. What if I told you that in a survey of 3,000 Dutch parents, 5%, that's 5 out of every 100 of those parents, admitted to having smothered, slapped, or shaken their baby because it was crying too much? And what if I also told you that among children in the US today, specifically Texas, 1 out of every 100 children will become a confirmed case of child abuse? So here it is. You can see 100 squares up there, and you can see the 5 children that will be smothered, shaken, or slapped. And one of those will become a confirmed case of child abuse. We don't know what happens to the other 4. They might be okay. It might have been an isolated event. Or they may also be truly cases of child abuse, because not all child abuse is discovered. So today, what I would like to do is present 3 ideas I have about how we could prevent child abuse before it starts. So there are definitely people working hard to prevent child abuse. But most of the people working on that, their goal is to help us identify children that are being abused, better identify them, and get them into treatment. Coming from the perspective of public health, my goal is a bit different. My goal is to try to prevent child abuse before it even happens. So let's look at one example of child abuse. This is shaken baby syndrome. So parents who might shake their baby a little bit, baby's crying too much, and you shake the baby a little bit, they're angry, they're tired. Some of those parents shake the baby too much, and babies don't hold their neck up very well, and the forces of that shaking can result in bleeding in the brain damage, and blindness in some of these babies. And this, I think, is kind of a good example, because there have been people who they shook their baby too hard, they didn't realize it, and they really were kind of innocents in a way. They just didn't realize that something so terrible could happen to their baby from shaking it. So in public health, we often go for a simple message, because we have a lot of quick messages we have to get out there. And the quick message for shaken baby syndrome, you sometimes see it around on posters: never, ever shake a baby. So one of our messages back, we're just trying to get into the public brain: never, ever shake a baby. There are 4 types of child abuse, and I'm focusing on trying to prevent 2 of them. The 2 that are kind of the most obvious, and well, not the most obvious, but the easiest to measure. So I'm focusing my ideas on physical abuse and neglect. A while ago, this is just a blank slide. A while ago, the difficulty of caring for a young baby was really underscored for me when I received a phone call. I picked up the phone and I heard sobbing. I really didn't know who it was at first, but then I realized it was a friend of mine. What's wrong? I've been having thoughts of taking the baby outside and putting her in the trash can and leaving her there. But you didn't do it, right? You only thought about it. And so my friend and I talked, and we talked about how if it got worse, she could just put the baby in another room, make sure the baby was safe, close the door, sit outside if she had to. And I was really happy that she had called me, that she had felt comfortable to call me and to ask for help. She went on to be an excellent mother. But for a brief period of time, she had these disturbing thoughts. So you could see from some of the material I'm going over that caring for a young baby can be really stressful. What can we do about it? So my first suggestion, my first idea, is that we need to publicize the fact that parents have thoughts of abuse and neglect sometimes. It's okay to have those thoughts, and it's okay to talk about it. So we need to remove the stigma around having those thoughts. If we don't remove the stigma around the thoughts, then parents will not feel free to come forward and to get help. They'll not be free to talk to their friends and their doctor, whoever else, about it. So we need to remove the stigma, and we need to stop sugarcoating the first year of parenting. It's not the glorious experience that it's put out to be. For many, it's very difficult. So we need to prepare parents for that. We can also teach parents techniques for dealing with crying infants, techniques for rebellious toddlers, but it is very, very important to remove the stigma. So some of you may think this is not a very realistic solution for such a difficult problem. Stay with me. Let me tell you about the experience I had that convinced me that child abuse is preventable. Years ago, I was working as a public health nurse, and I was asked to go out and visit a young mother because the pediatrician thought she was disciplining her daughter too strictly. I was worried about the visit. Many of the nurses in the agency were judgmental about our clients and how they mothered their children. But my supervisor had a different attitude. She said to me, "Kim, when you go visit that young lady, I only want you to do one thing. I just want you to build a trusting relationship." Now, this was surprising for me. I really thought that somehow it was going to be more complex than just having one instruction, but she stuck with it. She said, "I just want you to build a trusting relationship. You can visit her as many times as you want." So I went out to see my client, I'll call her Jennifer, and she had a newborn baby boy who was 6 weeks old, and she had a 2-year-old daughter. So when I got there, I noticed that she held the baby really close and warmly, like you would hold the baby. She appeared to be bonding well with her newborn son. Her 2-year-old daughter stood by her side silently throughout the 45-minute visit. The 2-year-old never left her mother's side, and she never spoke. I didn't see any bruises. So I visited with this woman a number of times, and I came to find out that she was the 4th daughter of her parents, and when she was born, her father was really hoping for a boy, but she turned out to be a girl. So she became her father's substitute son. And then when her first baby was born, she was really hoping it would be a boy and she could give her father this grandson. That had not happened, but now finally with the second child, she was very warmly attached to her son and very happy to give her father a grandson. So at one point, she gave me a beautiful pair of beaded earrings. I was a little startled and very happy because it meant that our visits were meaning something to her and things were going well. And then at one of the final visits, I did get down on the floor and attempt to play with the 2-year-old girl. And she very tentatively acted as if she might engage with me a little. And Jennifer, the mother, said to me, "I've never seen someone play with an infant like that before, with a child like that before." And I said, "Who have you seen play with children?" And she said, "Only my family." So Jennifer was parenting as she had been parented. So what I took away from this series of visits with Jennifer was the power of home visits. If we approach parents non-judgmentally, they will allow us to visit them, and they will benefit from a relationship with somebody outside their normal circle. So a question, though, does arise. Can we really spend healthcare dollars on this with just these subjective impressions that it works? Don't we need some hard evidence? This is the hard evidence that was first published 20 years ago. 20 years ago, a randomized clinical trial was published in the JAMA showing that home visits can prevent child abuse. So we do have the hard evidence. So my second idea is that we identify high-risk families at birth and we offer them home visits. 4 minutes? Oh, I'm going a little slow here. That's my second idea. Okay. So if we offer them home visits, we'll probably do home visits on about 10% of babies, casting a wider net than we need to. That's how screening works. And we'll base that screening on risk factors, especially on whether either parent has a history of themselves having been abused. And how sensitive will the screening be? Early work shows that the screening can be about as sensitive as our screening for heart disease. I'm suggesting we put the screening in the hospital at birth, because that way we can catch everyone and we can start home visits very early, because a lot of abuse happens quite early in the baby's life. My third suggestion is that we eliminate physical punishment for children under the age of 2. So spanking, which is usually what we're talking about, it is a deterrent for behavior in the short term. In the long term, it causes more aggression. And that's why the American Academy of Pediatricians advises against it. There are a number of countries, those in green in Northern Europe, that have laws against any corporal punishment in the home or in the school. So although it will be controversial in the United States, it will be quite controversial here, because 50% of mothers of babies under the age of 1 spank their children. So it will be controversial here, but I'm suggesting we have a law, make it a misdemeanor, that we do not spank or use physical punishment for children under the age of 2. My time is running short here. So this is my wrap-up slide. So how do we stop child abuse? First, we allow parents to realize that thoughts of abuse and neglect are common, and there are healthy responses to excessive crying and rebellious toddlers. Second, we identify high-risk families at birth and offer home visits. And third, we make physical punishment of children under the age of 2 a misdemeanor. And that is how we stop child abuse before it starts. Thank you.